what it is about your body that you feel you should seek medical attention or advice but are too lazy or afraid to do it. I have the same. Get up too quick and I'm dizzy, vision goes all black and white, snowy or sometimes goes completely for a bit. My doctor says he can treat it if I want him to, but if I can live with the side effects of the dizziness, it's far preferable to having high blood pressure further down the line. Said to up my salt intake, which is great because I crave salt and love a few sips of soy sauce. Both my daughter and husband, who are not related, have had asymptomatic cuties on separate occasions. No pain anywhere, no burning when urinating, no fevers, nothing until it was really bad. Daughter was 3 at the time, started vomiting as her first symptom. Husband fell asleep and went into sepsis this past January. I have all the classic symptoms of low thyroid, but I've had it tested multiple times over the last couple decades and it's always normal or low normal. Not low enough to cause symptoms as severe as mine, according to the doctors. As time goes on I get more tired, my skin and hair get more dry, and my eyebrows are super wispy and don't even reach the middle of my eyes anymore. I was told a symptom of very low thyroid is the ends of your eyebrows fall out and don't grow back. My CBC is always okay and I'm on meds for depression. I'm more tired than when it was untreated. I know the meds can cause fatigue, but it's just getting worse and worse. Hey, I was the same way. I'm terrified of the dentist. I put off going for 5-7 years or something crazy like that. I finally got the courage to go and straight up told the dentist, "Sir, I am fully expecting to get dentures today. It's been way too long." Everything turned out okay, no cavities. I was absolutely shocked. I said, "Are you sure?" Probably 3 times. Basically, it might not be as bad as you think. If you're brushing regularly you may be pleasantly surprised. Just hoping to spread some assurance and positivity from a fellow dentist avoider. I know this might be unpleasant to hear, but your teeth aren't nothing to take lightly. I almost died and am partially blind due to an infection that spread from my teeth to my eyes and brain. The US healthcare system is so bad, so I understand the no insurance part. If I didn't have my stimulus check, I probably wouldn't even be alive right now. I get that too. Think it's mostly anxiety related. I'm hyper-focused on my body being over 40 now, and I forgot what it feels like to just have a little ache and pain and think nothing of it. Now I feel something and hyper-focus on it. Right now, no pains, so I'm fine. But damn, before I was getting a couple quick and sharp stabbing pains in my heart area and internet is like it's probably gas or you're dying. It was probably gas, but my anxiety won't let me think or feel otherwise most of the time. For well over the past 2 years, I've had to wear a pad and tampons due to constant bleeding. Some days it's a lot, other days it's not much, but still enough that I don't feel comfortable going to work without a tampon. I actually have gone to the doctor for it, but they said it was fine, and at the time I was so uncomfortable about it that I didn't argue. I hate it so much. Find a new doctor too. Let them check if it is maybe a weakness of the corpus luteum. I had something similar. I was bleeding most of the time and it was so annoying. But taking the birth control pill can fix that problem. You should really give it a try with another doctor, and even if they say that it's not dangerous, insist that you want to fix it. That happened to me last year. Felt like a shooting pain going right up my ass. It felt like I was in active labor, and I was over 2 years PP. My milk went through something similar, but hers were a bunch of issues manifesting all at once because she doctor shopped until she's found someone who gave her all the pain need she wanted. It turned out she had polyps in her large intestine, parasitic worms, kidney stones, ovarian cysts, an irritated bowel from over-medicating herself, a UTI, and COVID-19. It's a miracle she's still alive. Odds are it's gallstones blocking your common bile duct, which your body responds to by causing immense pain. I kept experiencing that pain in my entire right side of my abdomen that would resolve after an hour or two. Eventually I was at work one night, at a hospital, and the pain started. and became so bad I was sweating profusely. The pain was an 8. I called our hospital manager and he wheeled me to the ED. Had my gallbladder out several hours later, after my COVID test came back negative. I'm pretty sure there's something wrong with the connective tissue in my body, like my skin and joints. I always find bruises on my body without knowing how they got there, like, every morning I wake up with new bruises. My cuts and scratches heal really slowly too. It usually takes around a month for a minor cut to heal, and then it leaves a gross scar. My joints are really weak too and I've had a few dislocation. One of my joints is always bothering me and I get a lot of pain around them. I want to talk to a doctor about it but no one really believes how much my body hurts because I'm always saying that I'm in pain. I believe you because I've been in a similar situation. Definitely recommend doctor, but in the meantime have you tried multivitamins and omega-3s? Might be some nutrients you're missing. Also recommend stretching every morning, maybe yoga or just some basic toe touches. Strengthening the areas around your joints might help with the dislocation. Doing those two things myself have helped me tons. I have visuals now. I've always had it but didn't know that it was an odd thing until a few years ago. Mine is present but mild and doesn't interfere with my vision at all. Reason I haven't seen a doctor? There's not really a cure and it's nothing to do with your eyes but rather things misfiring in your brain. I got a really bad sunburn as a kid, so clearly, I am doomed to die of skin cancer at some point. Well, there's a gooey mole spot that I can kinda scrap off with a fingernail, but it's on a part of my back that I can't quite reach so it's stuck. Getting a mole cut out to be looked at is a very scary thought. I also have very low energy. I can't do much anymore. I was found to have a B12 deficiency and the first week of the supplements was amazing but I'm back to no energy again. Like, left to my own devices, I'll sleep for 8 hours plus a 2-hour nap in the middle of the day. I just can't stay awake. I have a cavity in one of my back teeth. I can feel the little hole with my tongue. It doesn't hurt and it hasn't gotten any bigger in the 2+ years it's been there, but the last time I tried to go to the dentist, I almost bit the nurse because I started panicking and she didn't take her hands out of my mouth when I signaled like I'd asked her to, so I could breathe for a minute and then the doc said he was going to drill with no anesthesia and I lied and said I didn't have the money to pay for it, just so I could escape. So, I'm not exactly jumping to make an appointment. I probably will when it eventually starts hurting. The doc said he was going to drill with no anesthesia and I lied and said I didn't have the money to pay for it, just so I could escape. For very shallow cavities that's a thing. A very good thing IMO. As long as the dentist goes nice and slow like they should be trained to do in those cases. As the shot and soreness are way worse than the very slight if any hot feelings you get from the drilling. I had many cavities filled like that as a kid, and even two filled with no shot while studying abroad in Japan as an adult. Not only do you not have to deal with the numbness, possible nerve damage from the injection, and soreness, but you don't have to pay for the shot either. Take care of it now before it actually does get worse. Dental work is 1000x worse if you put off simple stuff and wait until you need major repair work done. You think you are anxious over a minor cavity? Just imagine if you wait and have to get a root canal and crown on that tooth to stop the crippling pain in your mouth. Less than greater than. As a side note, the drilling itself isn't what causes pain and discomfort. It's the heat from the friction of the drill bit. So if your teeth aren't super sensitive to hot foods and drinks, you likely won't feel anything other than a bit of vibration, and maybe the jet of cooling water the drill sprays out. If you do start to feel some discomfort, which will be a bit before any actual pain, the dentist will stop, and if it's repeated may then use a shot. My arms are worryingly weak, actually most of my body, but mainly my arms. Like I'll be making my bed, and I'll be absolutely exhausted by the end of it because the comforter and sheets felt like 10 pounds, and I have to rest. Or I'll lift my arms up to just put my hair into a simple ponytail, and it'll feel like concrete weights are pulling them down. As for the rest of my body, I just get super tired quickly, and it gets hard to breathe at times. and like my chest will hurt or whatever. I've taken some heart exams, X-rays, and some lung tests, and everything I've done came back fine. So many of my doctors have brushed me off or treated me like I'm lying. At this point, I've just given up on trying to figure it out. I know it should be looked into further because I'm only 21 seconds old. I have a pretty okay diet. I exercise. I'm not overweight. I'm not the fittest, but damn, I can't be that unhealthy, right? But at this point, I'd rather not be labeled a hypochondriac by local docs, so I'd rather not push it. Edit. Oh, and I got this pimple-looking thing on my face. It's no bigger than a dime, and it hasn't grown or spread or anything like that. Every time I've tried to pop it, it just comes right back. I remember, one time I did pop it, and another one grew right under it. Then that one went away and the original bump came right back. I've had it for 4 years at this point, and I've named it Steve. Sometimes it gets red and hella noticeable, but I haven't figured out a correlation yet. I have no clue why Steve just won't go TF away. I would get it checked out, but so as long as I leave him alone, I'm fine. If it's worth an evaluation since it's pretty small. I feel you. For probably 15 years I avoided seeing a specialist for my back. Not the same issue. I had debilitating pain up and down one leg. I would work 12 hours 5-7 days a week, and I'd be in tears walking to my car, limping around work, just plain miserable. Finally, I had bone replaced, disc disease, rods, pins and screws put in about 4 years ago. I've never felt better. I've pain at times. You never really get rid of it, but nowhere near the past levels. I do have permanent numbness in my lower leg though from nerve damage due to doing nothing to fix it for so many years. That kinda sounds like arthritis, but from what I understand that doesn't just happen in one knee. I had something similar but it got better after knee stretches and exercises. Then again, I also have floating pieces of bone near my kneecap that cause the grating, found during an X-ray. It might be worth having checked out. Best case scenario, you need physical therapy. Worst case scenario, you need medication or medical intervention. Your knees are important. Don't mistreat them. First part is probably low blood pressure causing orthostatic hypotension. I used to have this along with regular episode syncope. Sounds weird, but increasing your salt intake can do absolute wonders to help reduce symptoms and increase blood pressure. As a kid I would have to be wheelchaired to the school canteen during exams because my low blood pressure would cause me to faint, and the doctor literally advised the school to feed me bacon when it happened. My ovaries. I know I might have fibroids, cysts, but I can't bear the thought of never giving my boyfriend his own child. I have a 10-year-old already, teen pregnancy. I'm 28 now, and he's the morning most amazing stepfather ever. Everyone always asks me when we're having kids, and I tell everyone how I had a miscarriage last September. I'm scared of so many things that will come out of me possibly being infertile. So scared. I psych myself out about it every day and have hidden my depression about it. I just don't want to know. I want to keep telling people we're trying, when they ask. Or I just want everyone to stop asking me. Most ovarian cysts and fibroids can be treated without removing your ovaries or uterus. Fibroids can reduce your chances of becoming pregnant. They can also become enlarged and quite painful during pregnancy as estrogen levels rise. I encourage you to consult with an OB/GYN if you are having difficulties getting or staying pregnant. They can help to identify the causes and discuss treatment options. I have small black spots in my vision that move with my eyes, also actual floaters which look almost like a string of bacteria moving around my vision. I also get sparkles or a little flash of a white spot that disappears. I see constant visual snow, especially in artificial light. I have after images after looking at anything for too long and see trails of things after they move. I've been to an eye clinic twice and they said nothing is wrong with my eyes. I'm not a doctor, but I used to work at an ophthalmology office. That's a floater and they're totally normal. As long as you don't have like hundreds of them and no flashing in your vision, you're most likely fine. I didn't get them until a few years ago and they come and go. Usually take a few weeks to go away. It's just normal buildup in the fluid within your eyes and it passes across your retina. Hard not to freak out if you've never had them, but they're very, very common. I got this weird bump under my hurlobide. What it is, probably a cyst or something. Also this morning I woke up and my head was hurting, so I rubbed my hand over where it was hurting and felt my skin seem uneven, so I looked in the mirror in my room and I had this large cut on my head. It was red and looked like it had been there a few hours, but I laid back down and about 30 minutes later I went to the bathroom and looked in the mirror, but there was nothing. Like no cut nor scar, even my skin was normal. I'm extremely confused. I think I'm seeing things, but the fact that I felt makes it so strange. What happened? I actually just got my first hemorrhoid and it fucking sucks. Too taboo to tell anyone. It's also very uncomfortable. My stools have also been terrible my entire life. I almost always bleed. When I was little was constipated all the time. Usually pooping only once or twice a week. I try to eat lots of fiber, but my digestive tract must be whack. Sometimes I'd push so hard my nose would bleed. Now I go every 2 to 3 days and they're always rough. I didn't know this wasn't normal until I was in high school. Ever since then I've been too ashamed to go to the doctor about it. My teeth. I'm laying here unable to sleep because of excruciating pain that I'm quite sure is an abscess. It's been bothering me off and on for a couple of months, but I don't have insurance or enough money for the dentist. I have no idea what I'll do when I call my dentist tomorrow, but I can't tolerate this pain much longer. I'm pretty sure I have anemia, but the doctors won't take me seriously. I'm tired and fatigued all the time and other symptoms. I have multiple things that are well known to cause it: pregnancy, giving birth, anemia when pregnant, being vegetarian, etc. And what this could even be, but I keep getting bruises on my body, especially legs, without any physical trauma. Like a lot of bruises. To those with a menstrual cycle it should not hurt, ever. Uncomfortable, yes. A little bloating and mood swings, sure, but painful is not the word you should be using to describe your cycle. Find yourself a doctor who will take your symptoms seriously and not chalk it up to just being a woman. Take some Tylenol. A painful cycle can be hiding all kinds of cancers, blood disorders, cysts, endometriosis and more. I had to nearly bleed out for any medical doctor to listen to me saying my periods were too heavy and painful, and by that time I had stage 3 ovarian cancer, and I was still nearly sent home by the because I was too young for it to be anything serious. My gyno-oncologist was the one who said that periods shouldn't hurt. They shouldn't keep you from living life. My youngest Sil is 33 and has had horrible, debilitating periods since she was 9. Every 15th of the month, she dons sweats, fires up the heating pad, pops diclofenac and is on bed rest until the 17th, and she doesn't even bleed that much. I've done pad runs for her. She uses the light, ultra-thin ones and goes through 3 for the entirety of her period. Her PCP has run tests and ultrasound. She has small cysts on one ovary. He told her she should start a family, since she's well into her 30s, and then have an oophorectomy. She's a single, Christian virgin, and she was so offended she set her overprotective mom on him. The poor sod. 2 of her 5 sisters have had hysterectomies, as well as her grandmother. This is the perfect question for me. I can afford the doctor and I'm definitely not too lazy to go, but I will lose my job for going. I have celiac, diagnosed as a kid, but am unable to treat it, and so I just have to deal with the pain. I was also recently diagnosed with osteoarthritis in my jaw, but had to beg the dentist not to put it on my permanent record. So more pain I have to deal with. I'm scared it is possible that I have osteoarthritis in other parts of my body because my joints have just been declining, but I can't get those checked out. I've had this cough for years and I threw up once after deciding to cough. After that I've mostly always held it, and my BF says I should get it checked out, but nothing's happened in like 5-6 years, so I've always put off telling the doctor. It tongue.